The gastric sleeve is the most common procedure that is being done. And in our practice, 9 out of 10 of our bariatric procedures is gastric sleeve. So we focus on that procedure. It's not the only procedure we do. We also do gastric bypasses, but that's a minority of patients. Usually it's being done for insulin-dependent diabetes or severe refractory hypertension, but many patients with those diseases have been suffering long enough over their lifetime that they become very high risk for a gastric bypass. So we turn more to the gastric sleeve. The gastric sleeve is an operation that people don't quite understand. They wonder, what does a sleeve mean? Well, I just tell them to think about the sleeve of your shirt or your coat. What we're doing is creating a tube that will basically run from the esophagus back down to the intestine. So the excess stomach, I'm just going to pinch it off as if my fingers were a stapler. The staple line is run across where my fingers are, and everything below is removed entirely from the body. Of course, there's attachments along this greater curvature. All those have to be divided in order to make this portion of the stomach completely apart and separated from the sleeve that remains. And then, of course, the detached stomach, that's removed with the procedure. As said, it's irreversible. I don't know if any patients have asked for it to be reversed. The important mechanism, how it works, is this portion of the stomach, the upper fundus it's called, and the upper portion of the stomach contains some cells that produce a very important hormone known as ghrelin, G-R-E-H-L-I-N, and that's considered the hunger hormone. So when we remove the upper portion of the stomach especially, that tends to abate or reduce somebody's hunger permanently. So that's the main function of the sleeve. Also, the sleeve itself, when it's first created over a very small dilator or guide, we call it a bougie, we create the sleeve initially to hold approximately 2 ounces or 60 cc's of fluid. And we do test the sleeve with that amount. However, over the next several months, particularly after some solid food eating over a period of time, the sleeve will stretch. We expect it to do that, so that eventually it will hold approximately 4 to 6 ounces of food. That would be the proper size meal for a gastric sleeve, in other words, a vertical pouch, or a gastric band that would fit over the top and create a pouch on the top, or in a gastric bypass, again, more of a horizontal pouch, if you will. It's hard to do this on the model. And then we bring the intestine, a bypassed intestinal segment. So we're bypassing the rest of the stomach because we divide entirely across of it. But I hope that helps to give you a little bit more understanding of how it is that we're stapling the stomach for these procedures.